Hello and welcome back to another video of the Brainy Heart. In this video, we will be talking about myocardial infarctions. Myocardial infarction is just a scientific and fancy name for heart attacks. In today's video, we will be looking at type 1 myocardial infarction. This video is part 1 of a 2-part video series. In part 2 of this video, we will be covering the remaining types, and we will mainly focus on type 2 in the next part. But for part 1, which is this video, we will be focusing on type 1 myocardial infarction. So let's get right into it. Type 1 myocardial infarction is very common, and this is normally your typical example of a heart attack. If you ask someone what a heart attack is, they're most likely gonna give you a description of type 1. Type 2, type 3, type 4A, type 4B, type 4C, and type 5 myocardial infarctions are way less common than type 1. So many people don't know a lot about type 2, type 3, type 4A, type 4B, and the remaining types. Many people, however, know about type 1, but we will be going over the pathophysiology of type 1 and what you can do to prevent it, and we will also go over different tests that are used to diagnose this, and we will also go over some treatment procedures that are used to treat heart attacks. Let's start off by talking about the pathophysiology of a type 1 myocardial infarction. As you might already know, your heart pumps blood to other parts of the body. And how that works is that venous blood from the other parts of the body coming from the vena cavas, and then the venous blood or the deoxygenated blood goes to your right atria over here, and then passes this valve over here, which is the tricuspid valve, and then it goes over to the right ventricle, and then it passes the pulmonary valve, which is over here, and then it goes to the lungs, where the carbon dioxide in this blood is exchanged for the fresh oxygen that's in your alveoli, or the air sacs found in your lungs. And the oxygen comes from the breath that you took in. So now your blood is oxygenated, and it comes in through the pulmonary veins, and it goes into your left atria, and then passes the mitral valve into your left ventricle, then passes the aortic valve, which is over here, and then it goes to different parts of the body through the aorta. So that's basically what happens, and this happens because of the electrical conduction system of your heart. If you want to learn more about the electrical conduction system of the heart, check out my video about that over here. But your heart muscle gets blood, and it has a separate set of atrial and venous systems. And so when this blood, oxygenated blood, even though I'm drawing it in blue, it's because I have to contrast it, but this oxygenated blood leaves the aorta, and as it goes to different parts of the body and different atrial systems, it comes to the coronary arteries, which are the main arteries that supply the heart muscle with blood. Now you might be asking me, why does the heart need more blood when it's pumping out so much blood to different parts of the body? Well, that's because your heart muscle doesn't really absorb any of the blood that's passing through the heart and when it's getting pumped. So your heart muscle needs a set of arteries and veins to deliver and remove waste and provide the heart muscle with nutrients, oxygen, and other things to function and keep the cells alive. So your coronary arteries are wrapped around your heart, but it's kind of hard to show it in this diagram. So here's a picture of the coronary arteries and how they actually look in real life. But for now, for the sake of teaching and understanding heart attacks, I'm just gonna say this is your coronary artery. And obviously, your coronary artery doesn't just start out of nowhere and shut into the heart muscle from the bottom. Like I said, it wraps around the heart muscle. But there is the oxygenated blood that is going through, and this blood obviously has red blood cells which are carrying the oxygen, and it also has platelets which are there just in case anything happens, and then you have the white blood cells. And if you want to learn more about these different components of the blood, check out my video about that over here. But some people have coronary artery disease. Now, what is coronary artery disease? Well, that's when you have atherosclerosis in your coronary arteries. Okay, now you might be asking me, what is atherosclerosis? Well, atherosclerosis is just a buildup of fatty substances like cholesterol and other things like plaque, and when it forms on the sides of the artery, it can either cause blocks or it can cause heart attacks, but we'll get into more of that later. But atherosclerosis can happen in any artery of your body. So it can happen in your legs, in your hand, in any artery basically. When this plaque ruptures, platelets get triggered.
Let's say you fall down and you scrape your knees. You're probably going to experience some sort of bleeding. And after some time, you might have realized that the bleeding has stopped by itself. Well, essentially, what happens when you fall down is that the artery has a hole. So blood is leaking out of the artery and coming out of your body. Your platelets get triggered when this happens. They get triggered when there's essentially a hole in the artery. When they're triggered, the platelets rush to the area where the hole is, and then they clump together, basically form a internal band-aid. And when this happens, they essentially block the leakage. And if there's not enough platelets, they call for more help. And so more platelets come to the scene to help them stop the leakage. So essentially, you can think of the platelets as first responders rushing to a accident scene and trying to help everyone in that scene. And first responders as well call for help if there's not enough people there to help. A thrombus is when these platelets are triggered in at the wrong time. So they start clumping together for no certain reason, and this is basically like a false call.
A thrombus doesn't have to form because of a ruptured plaque. It can just form. And it doesn't have to form in a coronary artery. It can form in a artery leading to the brain, or in a vein in the legs that is called deep vein thrombosis, or if it can form basically in any part of your body, in any artery or vein. So in type 1 heart attack is when a plaque ruptures and creates a blood clot, and a blood clot, when this happens, it blocks the flow of blood to the heart muscle. So, when a blood clot forms, it can either fully block the artery or partially block the artery, but still causing very minimal blood flow to the heart muscle. So, this is basically a heart attack. When your heart muscle doesn't get enough blood, the cardiomyocytes, which are the cells found in the heart muscle, start dying. And when this happens, this is called necrosis. When a cell starts dying, it's called necrosis.
And when the cardiomyocytes die, they secrete a protein known as troponin.
And this is one of the ways to figure out if there is a heart attack. So when the troponin levels are high, it's most likely because you're having a heart attack and your cells are dying. When the cells die, they basically release troponin into your bloodstream. So that's one of the tests that a doctor will do if you go in with a chief complaint of chest pain or any symptoms of a heart attack. The doctor will most likely take a troponin level check to see if the troponin levels are safe. Now, obviously, your cells also emit a lot of other substances, but troponin is one of the major ones that is emitted, and troponin checks are used to diagnose heart attacks more than other checks. But EKG is also used to diagnose heart attack. A normal EKG will look something like this. If you want to learn more about what these waves represent, you can check out my video on the electrical conduction of the heart here. Now, when you're having a heart attack, two things can happen: a STEMI or an NSTEMI or a non-STEMI. So a STEMI is when the artery is fully blocked. So the blood flow is fully stopped to the heart muscles, and STEMI is usually more severe than NSTEMI. And NSTEMI, yeah, you guessed it, is when the artery is mostly closed, but there's very minimal blood flow to the heart muscle, but there's still some blood flow. So non-STEMI is a little less severe than STEMI, but both of them are really severe. In comparison, non-STEMI is a little less severe than STEMI. So when you're having a STEMI, then you might have a ST segment elevation. So as you can see, this ST segment is all the way over here, while the normal ST segment is supposed to be all the way in the bottom. So the next one is a ST depression. So a ST depression is when the ST segment is lower than where it's actually supposed to be. And this can signal a non-STEMI. So a ST depression means that your heart is basically being choked of oxygen, your heart muscle. And when this happens, your heart beats really fast and really insufficiently, and this can cause a lot of problems. And this can even cause cardiac arrest. Now, cardiac arrest is very different from heart attacks, because cardiac arrest is when your EKG looks something like this. Yes, that's when your heart flatlines. During a heart attack, your heart is not flatlining. During a cardiac arrest, however, your heart is going to flatline, or the EKG is going to have a flat line. And this is because the electrical conduction system has stopped working, literally. So normally when your heart is overworked or beating very insufficiently, which is normally happening during a heart attack, your heart's electrical conduction system can fail and it can stop working, causing a sudden cardiac arrest. And a sudden cardiac arrest can kill a person within 5 to 10 minutes. And if someone has a cardiac arrest, either go find a defibrillator, first call 911 obviously, and even if you're having a heart attack, you should call 911. And then if it's a sudden cardiac arrest, you should immediately start CPR if you're certified to do so. And then you should also, if you can find a defibrillator near you, you should immediately use that to shock the heart to start working again. So that's basically how a heart attack is diagnosed. Normally it's a EKG check and a troponin level check that's done. And there are other tests that are done to just make sure, but these two are very common. And a NSTEMI, and I forgot to say, but a NSTEMI can also happen when the T wave is flipped backwards. But yeah, those were the two major checks that are done to diagnose a heart attack. How can this be solved? One way that this can be treated is blood thinners. Aspirin is a very common one used to basically dissolve the plaque and the blood clot so that the artery is opened up again. For more major cases where a blood thinner will not be effective, a bypass surgery can be performed. A coronary bypass surgery is a procedure that restores blood flow to your heart muscle by diverting the flow of blood around a section of the blocked artery. And this is done by using a artery or vein from your leg. And this is normally going to be the saphenous vein. So they'll remove the saphenous vein from your leg and they'll place it normally in the aorta or one of the three arteries that are branching off the aorta. But for teaching purposes, I'm just gonna draw the saphenous artery over here. So remember, this artery has been taken from the leg and has been stitched into the aorta and the coronary artery. As this is the heart muscle, the blood is flowing this way. So we have gotten past the block. So the blood from the aorta basically comes through the saphenous vein, and it basically gets past the blockade. And now your heart muscle can be supplied with oxygen and other nutrients that are needed for the heart muscle. So that was the bypass surgery in a nutshell. Bypass surgery is a surgical method compared to blood thinners or other techniques. Now, I only talked about two different techniques, but there are multiple procedures used to cure a heart attack. These two are normally the main ones. A bypass for the major cases and a blood thinner is used for minor cases. Now that we know all the things that we wanted to talk about, let me give you a real life analogy. To give you a real life analogy of a type 1 heart attack, we can say that the coronary artery is a highway with a lot of vehicles, and these different vehicles represent the different components in your blood. And let's say there are these supply trucks with a lot of important supplies that a city is needing. And let's say this is city A. So there are these supply trucks. Let's say that they are red because the supply trucks are supposed to show the red blood cells in the blood. And let's say there are a lot of supply trucks, and then there are obviously going to be cars, maybe motorcycles. Then there is a crash. Let's say two cars crash over here. So when they crash, all the traffic is blocked. Now there's a traffic jam. No vehicle is moving, and the supply trucks can't get to the city, and the city is desperately needing the supply trucks' supply, or else it will not function, and many people will die in the city. And the people in the city symbolize the cells in the heart muscle. So this car crash, let's say, has blocked the whole highway. This means that it's a STEMI, because a STEMI is when the blood clot blocks the whole artery, causing zero blood flow. Now, an analogy for the NSTEMI situation would be that one lane is opened up because the accident happened in the first 4 lanes in a 5-lane highway. So one lane is open, and all these vehicles have to go through one lane in the highway, and that's very bad because the traffic jam's still gonna be there, but the vehicles are moving very, very, very slowly. That's a NSTEMI. That's basically an analogy that you can use to remember a type 1 myocardial infarction. I hope that all made sense, and I hope the analogy made it easier to remember, but that was it for today's video. I hope you enjoyed it and learned from it. I'm always open to comments, questions, and or suggestions. This is the Brainy Heart signing off. I'll catch you later in the next video.